Hello friends, today we'll talk about running and the heart health. And yesterday you all must have read the news that after Tata Mumbai Marathon, there were at least three serious cardiac adverse events. Two of the runners suffered cardiac arrest and is in the ICU on ventilator, and one runner had heart attack and for which angioplasty was done and he's doing well. And almost every marathon event we read about these incidents which are unfortunate, and so the doubt always creeps in whether running can have adverse effects on the heart or not. So today I'm going to clarify these events, or the relationship between running and the heart health. So first of all, I want to reassure you that running is definitely a healthy habit, and running over a long term reduces the risk of heart diseases, including heart attacks and several other conditions. And so therefore it increases the lifespan and longevity. So overall, running is definitely a healthy habit. Now, so definitely we have to look at the methods by which running can continue to remain healthy for us. So for that, there are few things to look at. One is the mileage. So definitely, running mileage is something that impacts not only the heart but other things like joints and ligaments and tendons and wear and tear. So one healthy mileage is supposed to be 25 to 50 kilometers of running in a week. So if you are running, let's say on 4 to 5 days, it would come to 5 kilometers per day to a maximum of 10 kilometers per day. So, and this can be sustained over a long term without much, effects on adverse effects on the health. And obviously, one has to have a rest day also, and then do strength training at least on 2 or 3 days in a week, and also do stretching after the run. So these things, go without saying. Now, whatever I'm saying, they are mainly for recreational runners. Of course, there could be, 5% of the runners may be elite runners, and they are in a different zone because they have more time on their hands, so they can train more, they can push themselves. So what I'm saying, it applies to only the recreational runners who are, not elite runners. The second thing in running is to look at the running pace. Of course, pace is thrilling, and if you run fast and achieve your personal best, and definitely it matters a lot, especially if you want to post your stats on the social media, and it's a kind of show off also. But if you're a recreational runner, the pace hardly matters because whatever you do, you're not going to reach anywhere close to elite runners. For example, if I tell you, if half marathon in Tata Mumbai Marathon yesterday, the winner was in 1 hour and 4 minutes. Now, whatever you do as a recreational runner, you can never reach close to that, and then obviously you can't train like elite runners, so there are more chances of injuries and other adverse events. So, as a recreational runner, do not chase the pace. So the one you have to run at moderate pace, which may be 7 minutes per kilometer. Depending on your training, it could be 6:36. But and then your usual pace, so you can only improve by say 15 or 30 seconds on the race day. But try not to overshoot or aim for much higher. And also for your most of the training runs, let's say 80% of the runs should be at a moderate pace, and aim for your best pace not more than once in a week, and with this you can sustain running over a longer period of time. Other method to look at is your target heart rate. So for me, what matters more is what is the running heart rate or the average running heart rate when you are running. So if you are running at an average heart rate which is very high, obviously it is not good. But if your running heart rate is on the lower side, it means you are a better runner, or your heart is more trained and accustomed for running. So for the same pace, if a runner has a higher heart rate, it is not good compared to a runner who has a lower heart rate. And one measure is to look at is 180 minus age. So you can aim for an average heart rate of 180 minus age, and that is also called a zone 2 running. And it's a definitely good thing for the heart if you're planning to run for a longer number of years. And then so in a summary, what I want to say is that if you are a good runner, I look at somebody who has a lower running heart rate, which is about 180 minus age. Other parameter is resting heart rate. So if you have been running for a long time in a good manner, the resting heart rate also reduces. So a good runner may have a resting heart rate around 40 or 45, 50. So if you have been running and your resting heart rate is still 70, 80 or much higher, that means you need to work on it. And then there are methods by which you can lower your resting heart rate also. So in the long run, if you're running average running heart rate and resting heart rate on the lower side, that means you're doing well, and it is good for heart health also. And then running definitely reduces the, like many people ask me that he has been a runner and he has been running for so long, he's ultra marathoner, then why did he get heart attack? So here we should understand that running lowers the risk of heart attack, but it does not make it zero. And the reason is that there are several risk factors. For example, say family history. So somebody who has a strong family history of heart attack, definitely that person will have a higher risk of heart attack whatever he or she does. So that has to be kept in mind. Then second is COVID infection. So many people suffer from COVID and their hearts are not the same. So I meet many athletes, many runners whose capacity or capability of running distances and also the pace has got severely compromised post COVID. So even if you did not have any documented COVID infection, there is a chance that it was asymptomatic, and we need to keep that in mind. And then the other risk factors. So unless you check your blood pressure, blood sugar, cholesterol levels, homocysteine levels, you may not know that you have those risk factors. So yes, a runner has a lower risk of heart attack, but there is still a small risk, and proper regular health checkups are required to unearth these other risk factors. Then the next thing is long distance running for a number of years. So let's say somebody is running multiple marathons or multiple half marathons going on for 10 years, 15 years. So such runners, they have a slightly higher risk of what is called as myocardial fibrosis and cardiac arrhythmias. So it has now been proven that they have a higher risk of ventricular arrhythmias. And so few runners, what we hear, they have a cardiac arrest. That is because of the VFib, ventricular arrhythmias, and then suddenly embolism or clots can form in the heart, and that leads to cardiac arrest. So the risk is very small. If you look at say marathon events, like here also in the Tata Mumbai Marathon, out of 60,000 odd runners, only 2 had cardiac arrest. So that's like 1 out of 30,000. So the risk is not very high. So we should not get totally scared of that. But one thing to keep in mind is that if your running mileage is not very high and you have not been running for too many years, or you are not trying to run much faster than your normal usual pace, then the risks can be lower. And also those events tend to occur in longer distances. So in a marathon, those events are more in the last say 8 to 9 kilometers, and those who run up to 10 kilometers, cardiac arrest has almost never been documented. So you should be careful. And then so most important thing is training. So if you are planning to run a marathon, it is not that you can just register for an event and then go and run the marathon. So it needs weeks to months, at least few months of training and dedicated training. You must have a fitness trainer, running trainer, coach, or you should learn from somebody who's accustomed and who has done this previously, and then train for it and then do it. So that needs training, strength training, nutrition, proper sleep. So many things go into it. But suppose somebody is having a full-time job, family, and then you run few hours, and then you say, okay, fine, I'll be doing this full marathon. So it because you want to tick off this bucket list or whatever, but it is not like that. See, running 5 or 10 kilometers may be fine, but if you are planning to run half marathon or marathon, you need dedication, you need time, you need few months of dedicated training, and train for it and then do it. And then during the run also, or even when you are training, your body may give some signals, because we read about a runner who is a seasoned ultra marathon runner from Mumbai, and he has done many half marathons also. But one of the training runs, he felt different. He had little bit of fatigue, and then he felt different. So he got a checkup done, and then he had a LAD block. So that means even if he was a runner, he had a block in the artery and he required stenting, and he backed out of Tata Mumbai Marathon. So if your body gives a signal, take it seriously. Meet your physician, meet your cardiologist, get properly evaluated. It is not that just because you have registered for an event you have to run for it. But if you are fully prepared, well prepared, you have done adequate amount of training, then definitely you should go for it. And then also the most important thing, or my last point, is that do not have any preconceived or preset targets. Like today my target is sub 2, today my target is sub 145 for half marathon. You cannot have a preset target because each race, each run is different. The terrain is different, elevations may be different, the temperature, humidity, heat, many things are different. You may not have slept properly the previous night. So you should, on that day morning, you should decide, okay, how the conditions are, how do you feel, how your body feels, have you had adequate rest or not, and then how the heat, humidity, air pollution levels. Based on all the factors, you have to decide how much time you're going to take. If you have a preconceived target, then the chances of casualties or you having suffering from any injuries are higher. Even you may cramp, you may have muscle cramps also, because if you're running faster in heat and humidity, like in yesterday's run also, many runners suffered from muscle cramps. So just enjoy your run, and then look at all these precautions. And once you take care of all these things, running is definitely healthy, and you can continue to run throughout your life. Age is no barrier, because there are many runners we know that who are in there. Even yesterday's run also, at least about 2000 runners were senior citizens, or even more than that. So you could run in at any age and continue for any number of years, but just take care of these precautions.